Welcome back to another episode of the Braun Performance and Rehab Podcast, powered by Isofit and Firefly Recovery. Isofit is my go-to for all things isometric strength training. For more on Isofit, be sure to check out isofit.com. Episodes like this are made possible by Firefly, the official recovery provider of the Braun Performance and Rehab Podcast. For more on Firefly, be sure to check out recoveryfirefly.com. This episode is powered by Dr. Ray Gorman, founder of Engage Movement. Learn how to boost your income without relying on sessions. Get a free training on the blended practice model by following at Ray Gorman DPT on Instagram. Connor, welcome to the podcast, man. I am super excited to work with you today. For people who aren't familiar with you and all the phenomenal work you're doing out there in Pittsburgh and now with the isometric space as well, would you mind filling in a little bit about who you are and all the great stuff you have going on, man?
Yeah, appreciate it, man. Good getting to catch up with you here, Dan. My name is Connor Schoepp. I own Rebuild Performance Rehab located in Pittsburgh, Pennsylvania. And we're basically specialized in bridging the gap between injury and performance and kind of helping athletes transition back from, initial therapy all the way back to getting back on the field, hopefully to a heightened state than before. And here we are.
I just want to hone in on that for a second and just how important that is and how much of a need there is for that in today's day and age, man. Like, as a physical therapist myself, I'm seeing more and more restrictions on the rehab side of things, whether that be declining reimbursement rates or athletes not having the amount of visits that they need in order to actually bridge the gap between day one post-op and full return to sport, and then even further return to performance level. There is such a need for someone to exist in that, speaking about ACL here, 3 to 4 month to 9 to 12 month timeline, because I feel like a lot of the times things get, go okay the first few months. And then at some point along the lines, somewhere the ball gets dropped, whether that's, hey, we can't do PT anymore because insurance isn't going to cover it, but you're not really sure where to go from there. Or maybe the PT just is not progressive enough, whatever it is that way. I think that there is such a need for people to exist in that 3 to 4 months to 9 to 12 month time space that way in relation to the ACL, especially just to help athletes on their return to sport and return to performance progressions, if you will.
Yeah, man. I think it's been interesting for sure, right? Like I see it on the client side where you just talked about where, especially for athletes who have completely different rigors that they have to return to as opposed to public population. Yeah, they get through 3 to 4 months of rehab and then they just get the boot and then there's awkward stage and we wonder why, re-tear rates are so high, re-injury rates are so high, why we're seeing such poor outcomes, even if they do return. Right. And then I think on the practitioner side of things, there's a lot of performance coaches out there. There's a lot of sports medicine practitioners out there. But there's not a lot of people that are maybe educated or at least well-versed or well-experienced kind of in that gap, if you will, of, actual performance and injury. Right. And it's unfortunate, right? I don't think it's anyone's fault. I think it's more of a field thing where there's a lack of education aspect and, but I do think it's getting better. And I guess thankfully for me, it's provided a niche that I've been able to, so far start to fill.
Absolutely. And again, it's a niche that's really, really needed that way. We've had this issue for a long time of athletes' return to sport rates not being as good as we want them to be, or maybe re-injury rates are higher. Maybe return to performance rate is not what we want it to be. And we need to bridge that gap and start fighting the good fight against some of those alarming statistics that way. And again, that's where the work of individuals such as yourself really comes into place. And one of the things that you and I connected on quite a bit when we were first talking was this shared interest in isometric exercise that way. And I might have certain biases around that, but I was using isometrics long before those biases were in the picture that way. I noticed a ton of benefit from using isometrics when I was in college, just trying to lift and get stronger, be the biggest guy in the gym. I was using them in a lot of my rehabs and even return to sport standpoint as well. But I found you need to have some kind of framework for how you think about isometrics, how you program isometrics, how you progress them, and just a thorough understanding of the types and what they do, right? The tools in the toolbox and when you want to reach for one versus the other that way. So first off, man, I'd love to get your thoughts about your framework around isometrics that way. How do you think about this concept of training movement without actually moving?
Yeah, man, that's a great way to put it. I would say when I think about isometrics, I come back to 3 big benefits, right? When I talk to people about these things, right? I think for me, the biggest one is, where I usually start at is educate, right? I think there's a huge motor learning aspect that comes with isometrics. And I think particularly it's always played well within the, return to play setting, right? I think one of my principles that I've always leaned heavily onto is that all injuries are brain injuries, right? And like, I think where I really started getting into isometrics was actually one of my first ACL cases where I didn't have a whole lot of experience working with athletes with these, significant inhibitions, right? And I was like, golly, like, where do I start? And it's like, they can hold a position for 30 seconds, at a really low intensity. Like, man, let's start there. And I started to look more and more into it. I started to see the benefits of it. And it's just like, man, like, I think it comes back. It's one of those things. It's so simple that like, if you want to get good at something, spend time doing that thing, right? If you want to improve quad strength, if you want to improve strength in a certain range of motion, if we want to do, you know, all these things, right? Just spending more time in that area, right? And so I saw huge benefits from that, right? Just this motor learning aspect, being able to restore and mitigate some of those inhibitions early on. And then two, I would say isolate, right? And so isolate to me just means that like, and you talked about a little bit there of like, there's so many different kinds of isometrics, right? There's overcoming isometrics, there's yielding isometrics, there's quasi isometrics, and all these different things that kind of fall on that scale of extensive all the way to intensive. And it's like, we have so many different options that we can take and apply across this huge bandwidth, whether we want to improve tissue quality, connective tissue, whether we want to improve strength, whether we want to improve speed or tendon stiffness, right? Like there's just this huge bandwidth in this huge toolbox of isometrics that it kind of provides, making it really applicable across, I think, just about any scenario, whether that's early stage return to play, end stage return to play, in-season performance, off-season performance, whatever it is, man. I think there's so much benefit to it. And I think the cool thing about it is like, you're only limited kind of by your imagination there, right? And then the last one that I'll usually hit on is isolate, educate, and then potentiate, right? And what I mean by potentiate is just like, I've yet to find something that has as potent of stimulus as isometrics at that low of a cost, right? Like anytime we introduce a stressor to the body, there's going to be an inherent amount of cost that comes with that, right? If we sprint really hard, there's going to be attacks on the nervous system, right? If we lift really heavy, you're going to see peripheral, costs on the body. But it's amazing what kind of stimulus you can continue to get out of isometrics at a relatively low cost, which is one, obviously great in the rehab setting where we have to be very careful and hone in our scope of practice and like how we go about stressing the body to mitigate possibly doing any sort of harm. But two, in the team setting, where I spent the last 10 years where, we have so many other variables that we have to worry about, and the sport always being the most important one, to be able to provide a huge stimulus while not having any sort of negative effect on that, man, I just found it so valuable.
To kind of run it back through the points you outlined there, isolate, educate, and potentiate. I love the isolation effect that comes with isometric, and maybe it's just because there's a ISO and ISO and both that way. They tend to go hand in hand with one another. And I think that earlier on in that rehab process, you start this process of understanding, hey, in order for them to return to sport, what positions are they going to have to get into? What angles is that going to be at? And how can I start getting some kind of isolated muscular recruitment in those ranges now? How can I get ahead of the game now so that when they do get to that point, I don't have to worry about things like, are we actually getting the quad to fire? Do we actually have enough knee extension force output to withstand the demands of sport? I've already checked that box because I've broken things up into the isolated components that go into the larger puzzle that way, right? I take care of each individual piece. So when I put the whole puzzle together, it's a complete fit. The picture looks good. We're off to the races. To the point you made on education, especially in the return to play population, a lot of them like to avoid loading onto the injured tissues, right? Whether that's ACL and a tendon graft was harvested, whether that's, a hip scope was performed or some kind of ankle procedure that way, the body compensates in such crazy, gnarly ways. And it's almost like this surgical learned behavior of avoiding any kind of load through the surgical site or through the injured tissue. So it's a matter of how do I educate the body to kind of take the alarm bell off and say, hey, look, we can actually load this. We can put force through it. We can fire these tissues and it's going to be okay. But it's a education process to the point you made about motor learning. It's relearning how to do these simple things. And it's something that I think we often overlook, or at least I overlooked early in my career that way. You know, when I was in PT school, we have all these neuro classes, and I'm just like, bro, I'm going to work with athletes. I don't need this. And then I graduate, I practice for a month, and I'm like, shoot, I actually need to open up those books again. And I need to go back to the motor learning principles. I need to go into the whole concept of attractor states. And I need to learn more about this because it plays such an integral role throughout the entire rehab process. And then the other thing you mentioned was about potentiation and there just being such a great bang for your buck with isometric exercises. I'm speaking globally about all types of isos. I don't care if you're doing overcoming, yielding, quasi, functional, ballistic, whatever it is that you're doing. It's like, you know, you're not moving. So you're either fighting the effect of gravity, which I can make more difficult by adding more weight, or you're pushing or pulling into something that's not going to move, bend, or break, right? It's just a failed concentric in a way, if you will. And I think that you can get so much great stimulus from that. I mean, hence the reason we measure so much isometrically, right? Whether you're doing a thigh pull or a belt squat, it's like, to me, those are the true assessments of max force output, right? Like, yes, 1 rep max testing is great. You know, when I was in high school, I 1 rep maxed my bench like 3 times a week because that's what you did. But it's like, I realize now that maybe there's a better way to get a thorough understanding of force output than just 1 rep maxing everything all the time. And again, that's not necessarily cost effective, especially when athletes might be in season. You know, if you show them a 6-second overcoming isometric thigh pull, oh yeah, great, they'll do that. But if you show them a 1 rep max deadlift, that might be a little bit more intimidating and costly for them to have to do, especially in season that way. So I love the points that you made and how you kind of outlined that framework thus far, man. We have that process of isolate, educate, and potentiate, and hopefully by the point that they're coming to work with a strength coach or sports performance professional in the rehab return to play process, hopefully the isolate bucket has already been taken care of. However, I'm sure you and I have both seen cases. I've got a couple right now actually where, you know, the athletes didn't start with me. Maybe they're 6 months out, a year out from surgery, and they missed the whole isolate concept. And now we don't own anything that relates to quad function whatsoever. Walk me through kind of your process of, hey, you know, we're at this point in the rehab process. You know, we're 9 months out, we're 10 months out. We should be talking return to sport. But unfortunately, we missed steps along the way to get there due to factors outside of my control. How do you go about using isometrics in your framework to help kind of bridge those gaps and fill in the things that might have been missed along the way?
Yeah, it's a good point because I get so many cases where athlete comes in, and you know it's not necessarily always the practitioner's fault. I think it's an easy thing to point to of like, well, they weren't able to completely restore extension or flexion or quad girth or what have you. Sometimes they just don't have enough time, but I think that is a very strong reality where I do get a lot of those things. And it's like, well, we are 6 months out, but we still have atrophy. They're still not, even just subjectively feeling it in the quad when they perform activities. So, isometrics for me, man, it's just a really easy way to take a step back and even continue to work on some things that they're maybe already for and that are a little bit more progressive in terms of that timeline and the objective and subjective criteria that they've met to that point. But I guess to your point, being able to take that step back with isometrics, especially from a motor control standpoint, and just spending time in that area and trying to make sure that we are working on those things that they need to work on, right? I think for me, it goes back to kind of that concept you talked about a little bit earlier of like stress shielding, right? Where if we measure, let's say, an athlete's knee extension strength, right? And they say it's like, oh, well, it's in 10% of each other. And then I take just a look at their quads and it's just like, oh, wow, like they're not nearly the same, right? And it's just the idea of like, okay, well, clearly there's some sort of stress shielding effect going on of while you've been able to reach the same outputs, there's different muscles taking over that job, right? And then so for me, it's just pretty simple of like starting out very extensively with long duration isometrics and spending time in that range and just trying to get them and putting them in a position to feel that muscle fire, right? It's one of the things we talked about before the call, like EMG data, and I think there's some value to it, but it has a long ways to go. And it's just not quite there yet. But for me, man, like if I can just put somebody into a position and get them to feel that muscle fire and just spend a lot of time there, then it's easy, man. Then it just becomes progression like anything else, right? It's simple to complex. isolated, integrated, general to specific, like all these things, extensive to more intensive. And so I think just by starting at the lowest common denominator, like, hey, what position is it going to put that, or what position do I need to put them in to feel this muscle? How much time can we spend there? And then at what point do I need to start loading that?
Absolutely. And to your point about just kind of that relearning effect that you'll get kind of waking things up within that muscle. I mean, I think of a few different things. I mean, one, especially with some of these different tendinous procedures, whether that's Achilles tendon or tendon harvest for ACL, there's always some kind of pain inhibition that comes with that. And a lot of times, I'm not sure if the isometric benefit for them getting stronger in those positions comes from the actual using of the muscle or the actual analgesic effect that we get through actually putting loads through the tendons themselves, which were surgically disrupted that way. And I think that, we don't have to have the 100% firm answer. Like, it's not like chicken or egg here. It's just a matter of knowing, like, this is a powerful tool in the toolbox that's going to make improvements on that specific thing. And two, to your point about this just being like an easy entry point for athletes, regardless of where they're at in the process. I just think of the work of guys like Keith Barr, where it's like, dude, they're doing ISOs every 6 hours all day long. Like, it's a very high load from a volume standpoint, but this is the kind of thing that you can load like that safely. And you can give your athletes to work on when they're not right in front of you within your own gym space or your clinic space or whatever that way. Like, I have no issue giving the guys and the gals that way, 5 minutes of overcoming isometrics 2 to 3 times a day. And to me, it's like, that's what we need to do to move the needle forward. And again, there's other pieces to the puzzle here. I want to make that very clear. Isometrics are not the only thing that I do, but if done correctly, they can be a very integral part of the entire process. And I think that I would say maybe it makes up 20% of my framework, but it's the 20% of my framework that gives me 80% of the results and outcomes, if that makes sense.
No, absolutely, man. You hit on so many good points there that I think are really, really important. I think like the pain one, I think has been huge for me. And one of those things I've kind of changed my mind on over the years, right? I think like coming from the performance side of things, I was never like a huge believer in that pain is always the greatest indicator, right? And I think that's to a certain extent that's true, right? Pain doesn't necessarily mean damage or loss of function or all these things, right? But I think where I've grown, or at least one of the things I've changed my mind on over the years, is just how much the brain plays into everything. Going back to that, principle of all injuries are brain injuries, and how much pain is going to exacerbate those inhibitions, whether or not there's damage there or not. And being able to utilize those extensive isometrics, not even necessarily from a physical competency standpoint, or like necessarily that we're driving, strength adaptations or even structural adaptations, but just the fact that we're loading the body in a safe manner and that the brain is learning that that's okay. That's just going to continue to open up those qualities and your ability to produce force at higher levels later on, right?
Absolutely. And to that point as well, I completely agree that pain never tells the full story, but I like having a active approach to managing pain. I think there's a time and a place for passive elements, your tissue work, your cupping, your scraping, all that stuff. There is a time and a place for those things. But if that is your only strategy, then you're really missing the mark here. I think you need to have an active component of it. And at least for me, like I try to make the athletes as independent as possible in their management of that, because I don't want to treat pain. This could be a whole separate discussion on if physical therapists treat pain or treat movement, because we can't even agree on it. But I think the more active I can get them involved in their own management of those symptoms through things like isometrics, the better off we do long term. And obviously, I think one of the big things that helps with that is having some kind of markers, something that I can look back on, like a KPI almost, where I say, hey, look, you came in initially, this is where we're at, this is where we're at now. And a lot of that, at least for me, comes back to testing isometrically, whether that be, you mentioned knee extension, iso thigh pull, belt squat, and so on that way. What's been your framework for testing with isometrics? Because obviously, if you're using isometrics in your overall return to play process, having some kind of framework for assessing the effect that they have, in my opinion, is very important.
Yeah, so it all depends on the context of the athlete that I'm working within, right? So I'll start from the performance side of things, because that's kind of where I really started on the testing side of utilizing isometrics. So my last job, I was the director of sports science at Liberty University for about 4 years. And I kind of got my start in coaching as a speed coach, right? Like that's kind of where I made my bread and butter, and where my first passions kind of lied, and what led me to return to play. Ultimately, being able to bridge the gap between initial therapy and the return to run process. But all that to say is, on the performance side of things, I generally look at like three big areas, right? Especially for like your locomotive athlete, of the knee, ankle, and the hip, right? So, those things are going to be a little bit different. I'm fortunate here now that I have some access to some technology that I can look at a bent knee variation where I may be isolating the soleus a little bit more. I'm looking at the gastroc a little bit more and more of a run specific ISO. If you're familiar with some of Alex and Tara's stuff and some of those more kind of quasi like high post positions. And then the same thing with the knee, right on the performance side of things, transitioning to a little bit more knee overcoming isometric in that same kind of high post position. And then I'll look at a hip extended, or not necessarily hip extended, a knee extended, about roughly 10 degrees hip extension ISO overcoming test, where they're just driving that foot down into the force plates. And then I'll look at a hip extension ISO test where the knee is at 90 degrees. And for me, it's just kind of trying to delineate between acceleration qualities and max velocity qualities, where one, we're in deeper joint angles, two, we're in a little bit more of a shallower joint angle, right? And then in terms of the rehab side of things, it's going to depend upon the injury and kind of where we're at in that process. I'm not a huge proponent rushing to the isometric testing. I think sometimes it can do more damage than good, right? So I think slow cooking that process in there, maybe mid to later stages of the rehab process. And then for me, it's just trying to get a baseline of, okay, where are they at, right? I'm in a private setting now where I don't train a ton of athletes consistently that get hurt, knock on wood. Most of the time when an injured athlete's coming to me, they're coming from somewhere else. And so I don't have any historical data on them. So for me, I'm just trying to, in most instances, trying to get a baseline of, okay, how does this limb and this injured area compare to their non-injured limb and their healthy side? And then for me, it just becomes really simple. Like, okay, where does that asymmetry lie? Right. And that's going to tell me a lot about where we need to start in this process. So like a big one for me, like, if we're looking at anything lower extremity, we're never going to start the return to run process if there's any sort of asymmetry greater than 30%. Right. So for me, I just follow like a stoplight system of 0 to 10%, good to go, right? A little bit of asymmetry is very normal, especially in specific sporting populations, right? 2, yellow being that 10 to 14% range. It's like, okay, this is cause for concern, but we're probably good to go. And then anything over 15%, I would consider a red flag, in terms of like, okay, we need to, this is something that we definitely need to target right now and need to continue to address as a KPI to progress them forward.
Quick break, because if you're a rehab professional sick of burnout, this could be your answer. Engage Movement's blended practice model is a proven system built by Dr. Ray Gorman, a PT who walked away from the 55-hour-a-week grind and built a blended practice model that doubled his income while working less than 25 hours a week, and he didn't have to rely on the traditional way of selling sessions to do so. It's all about blending remote and in-person services, stacking monthly recurring revenue, and building a business that finally supports your life, not the other way around. This model isn't just theory. Real providers, including myself, are creating lives of freedom and flexibility without being tied to their schedule. And as a listener, you get free access to the complete training. DM my name, Dan, to @RayGormanDPT on Instagram and receive your free breakdown on the model. Absolutely. To your point, I think the conversation about asymmetries is very different when we're in the rehab return to play setting that way. And just to kind of run back a lot of the things that you outlined there, I mean, first off, having an isometric assessment and testing battery from a performance standpoint, in my opinion, is an essential tool in the toolbox. And again, it's not the only thing that's done. There's still plenty of jump testing, hop testing, right? Like in my ACL return to sport, I still do Cincinnati hop test on all my athletes that way. But I also look at the isometrics as well, whether that be in isolation, like you mentioned, knee extension, knee flexion, different hip extension positions. Obviously, Natera's work is incredible. Knee extension, iso push, hip extension, ankle iso push, all that stuff is great, and it gives us valuable insight and data, but it's more about how we put all the pieces together and how it tells the story, in my opinion. It's not just the numbers, it's not just the asymmetries, but it also, as you mentioned, matching it to this specific athlete, matching it to their sport demands and sport qualities that way. Because I found a lot of times where, the numbers might look like, oh, maybe it's a little bit concerning, but when we put it into context of their sport or their injury history, like, what, it's a very different story, right? If I've got an athlete who's had 3 ACL injuries on the same knee and they've harvested a quad tendon, they've harvested a patellar tendon and so on that way, and he's at 88% quad index left to right, then you know what? Maybe he doesn't need to be at 90 because we've literally taken out so much from a surgical standpoint. The knee has been damaged, the tendons have been harvested multiple times, and it's like, what is truly possible for him? Could he get to 95, 100, or, is 88 where we're going to be? So understanding how that subjective component plays into the whole thing, I think, is absolutely critical that way. And even how isometrics compare with some of the other testing that gets done, right? Do you do like a DSI with the athletes that you work with at all?
I don't. I would say it's interesting you asked that. It's probably one of the biggest changes that I've made over the last couple of years in terms of the performance aspect side of things. I've gotten away a little bit. So I do love an overcoming belt squats. I think that's extremely valuable. I think the learning curve is very low, and it's a very good measure of true output. I did the overcoming or the isometric mid thigh pull for a long time. And I think the longer that I did it, one, I've run into some issues every now and again of athletes that just wouldn't respond well to it. They just didn't love it. They would run into some back issues. I think what I started to realize over time, it became like a really, really extensive grip test, right? And like we would strap them up, and I know there's even some people out there taping athletes' hands to the bar. I think that's probably a little too far for me. I don't know if we have any sort of time for that at all. But I've gotten away. All that to say, I've gotten away from the ratio data in general. I think it's really valuable. I think giving you an understanding of who your athletes are, and it's a great way to track training effect. I think especially isometrically, and like the training effect of just improving general strength. But in terms of like using dynamic strength indexes in general, I started to gravitate away from that just because it lives on the spectrum of this idea that there's an ideal ratio for athletes. And what I've come to realize is you're better off leaning into an athlete's strengths to an extent versus leaning into maybe what their gaps are in their system. And that's not to say there's not times throughout the year we don't need to work on deficiencies. But in my experience, especially in the performance side of things, gravitating towards more of their strengths has been a lot more fruitful for me than maybe leaning into some of their deficiencies.
Absolutely. I completely agree with that. And I think if you're going to use DSI in this kind of setting, what I've found, and this is again based on my limited experience, is that if you have pre-injury numbers, then it's an extremely helpful tool because now I have some kind of understanding about pre-level function, pre-injury function, where they were at from like a overall like profiling standpoint. To me, some kind of data is always better than nothing. So I think the DSI was a very valuable tool for that. But to your point, through the rehab process, like I didn't really make a whole lot of clinical decisions off of DSI alone. I think it can be helpful, especially for some individuals from a profiling standpoint. And we literally just did a podcast the other week with a guy all about the DSI. So there is value and merit to it, like you mentioned, but it's also understanding what is the number actually telling us? What does it mean? What are we going to do with it? And I think to your point as well on the, the thigh pull that way, it's interesting to me how something like that can sometimes cause lower back pain and some of these other things to flare up a little bit because a lot of the times the athletes I work with see it as a lower threat than something like a heavy RDL or a heavy deadlift or something like that. They just don't perceive it the same way. I've even had some athletes who have back pain or some of the lower back return to sports that we do, whether it be spondies or something like that. There's almost like a fear component for them with deadlifting, but on the thigh pull, they have no issue gripping and ripping 500-600 pound force output. So it's interesting to me kind of the psychological component that you get with isometrics in the sense that athletes perceive them as low threat because there's no movement involved, but in reality, you can still get extreme high force outputs with these kind of training tools.
Yeah, absolutely, man. I think to that point, that's one of the things I've learned over the years and leaned into. Like, and that's a good point, I think, for the return to play setting, especially too, of just like the body will always sacrifice force and velocity for stability. So by putting them in that stable position, especially with something like an overcoming isometric, it gives them a more stable platform to push and just, I think decreases some of that inhibition and just more than anything, gives them more confidence to be able to push harder as opposed to something that's more dynamic in nature.
Absolutely allows them to use your word from before, potentiate, right? High stimulus, low cost for the athlete that way. And going back to that kind of framework of isolate, educate, potentiate for a second that way, we've mentioned a few times that there's a lot of different types of isometrics, whether you're doing eccentric, quasis, functionals, all these different things that way. Do you have certain types of isometrics that you like for different pieces of that isolate, educate, potentiate process? Obviously, we talked about the long duration ISOs in relation to isolation, but do you have any other like things that you've really found a lot of value and benefit from a type of isometric, a overall programming of that isometric for the specific goal that you're trying to work on for the athlete?
And so again, there's so many different things that you can target with that. And again, that's the beauty of it. But as you know, they can also kind of be the pain of it of like, well, there's so many different options that we could do. And it's like,
It's almost
a lot of things work. It's what's best for that scenario in that context, right? But your point earlier, like no component in isolation is as important as how those components all fit together. And all that to say is like, I guess for me, there's types of isometrics in the sense of the big three for me are just overcoming, yielding, and quasi. And right. And so for like those, now that's like maybe not as familiar listening to this podcast, overcoming just being pushing into an immovable object, also known as pushing or pushing isometric muscle actions. There's yielding, where you're resisting an external force or your body weight, also known as holding isometric muscle actions, right? And then a quasi isometric muscle action, which is basically, you can make the argument that all movement is quasi-isometric in nature, because if we look at movement, it's especially dynamic movement, it's triphasic in nature, right? Where there's an eccentric, an isometric, and a concentric component, right? But in this scenario where we're talking about exercise selection, I'm more so talking about exercises where there's an isometric component going on, while there's also simultaneously going on a dynamic mode, right? A very easy example would be like a suitcase carrier where you're carrying one dumbbell. The core is functioning isometrically, but the rest of the body is still moving dynamically, right? And there's a lot of different examples that we can get into that. But those are the kind of the big three. And each one of those things have different examples in different times and places within kind of the system of how you go about programming these things. And then there's qualities of isometrics that you can control. So for me, I start out with just extensive, right? That's just your long duration, lower intensity isometrics. Primarily in this, if we're driving structural adaptations at the tendons, especially early stage, or we're trying to target specific muscle activations, this is generally where we're going to start. Things I utilize in that scenario, I love just the long duration stuff. I would say generally the minimum, I try to start out 30 seconds, and I'll try to build out to a total volume of 2 minutes of work. Sometimes in, certain cases, 3 minutes of total work. Other things that fall into that extensive category are isodynamics, where we're holding an isometric position. We're driving a stimulus to that targeted tissue, increasing blood flow to that area, and then following that up with dynamic reps. I've had a lot of success with that, I think, in the rehab setting, but too also postseason regeneration, just because we get a bigger bang for our buck because of the lighter load and, I think both the isometric and dynamic component. And then generally progressing to more extensive stuff, right? Like I know like Keith Barr has been a big component of that, of like your 5x45 stuff, right? So just all I'd say, lower intensity, longer duration. Then the next quality being grinding isometrics, where we're focusing on strength and really just, trying to reach really high outputs, right? That can be either overcoming or yielding, right? I think when I think about like yielding isometrics, there's an eccentric quasi component to it, right? And so I'll kind of, and on the flip side, overcoming a concentric quasi component to it, right? So I'll kind of account for those things and the different qualities that those bring. But for the most part, I would say in earlier stage off-season training, I would gravitate towards the yielding and then gradually progress to the overcoming, just because we are able to reach higher levels of peak force with the overcoming isometrics. And so that kind of takes away your grinding stuff of like, I would say 2 to 5 seconds is kind of where I live in that range there, and trying to build up to, an intraset total time under tension of roughly, I would say anywhere from 12 to 30 seconds. right? And that's one set. I would say across multiple sets, that's probably going to be roughly, I don't know, anywhere from 30 seconds to 90 seconds, somewhere in that kind of range there, probably even a little overshooting it there. And then we can get into, so we have the extensive, the grinding, and then to me, it goes into the ballistic stuff, right? And so ballistic is where we kind of start to bridge the gap, or not necessarily bridge the gap, kind of jump back and forth between like what's a quasi isometric and the yielding and the overcoming, right? So for me, that could be things like drops, just jumping off a box and sticking a landing. That could be dynamic switches, right? Where going back to some Alex and Tara stuff of the shoulders being elevated on the box and the feet, and then just performing like a dynamic tantrum, right? Back extension iso drops where we're holding a plate in a back extension position and dropping it, driving a lot of force to the posterior chain and short time frames at rapid rates, right? So we're more so going back to the idea of like, okay, we developed the structural adaptations, we developed the strength qualities, and now we're trying to learn to apply those things at rapid rates, right? If there's anything I know, I've worked with a lot of athletes. Rarely is it the strongest athletes that are the best ones. It's the ones that can produce force through the neuromuscular system at the fastest rates within the context of their sport, which is why I think there's also a huge motor learning effect with these things of just being able to learn how to apply force at rapid rates in really controlled and isolated positions. And there's a million different things we could do there of, like I said, drops, switches, catches where we're, performing dynamic switches with a safety squat partner back, so on and so forth. Oscillatory isometrics kind of fall into that category as well. But all that to say, those are kind of the big things of in terms of there are kinds of isometrics, and then there are qualities of isometrics that we use to target.
Absolutely. I love the way that you broke that down based on qualities that way and kind of working the subtypes in as you went that way. And I think there's just so many different directions we can go from that and so many different things to unpack that way. I mean, first off, as you were kind of mentioning, they're starting with that long duration, low intensity. Again, this is the kind of stuff that I really push people to do early on in the rehab and return to play settings. Or, if you're an athlete who, is not injured, which is fantastic, phenomenal, let's keep it that way. I have no issue starting you off, postseason following some recovery, like, hey, look, let's work in some long duration, low intensity isometrics there. Just get some of these different qualities firing. And as you mentioned, there's a lot of different ways you can go about it. And that's very athlete dependent, right? So for some, as we mentioned in relation to some of the post-ops like ACL, knee extension, obviously a big one for other athletes. Maybe they're not injured and they're just, again, reintegrating back into their training program after a little bit of time off in the postseason that way. There's certain qualities they might be missing. One of the ones I've been seeing a lot of discussion about lately is hip extension. So it's like, hey, can we actually get that athlete to extend the hip and hold that position? Can they generate force from that position and so on that way? So I think understanding the qualities that you're trying to train, as you mentioned, understanding what the athlete needs and then how you can go about it is a great framework. You also mentioned about isodynamics as well, which I think, don't quote me on this because it's been a while since I talked with him, but I'm pretty sure some of Kyle Salmon's framework involves a lot of that isodynamic stuff as well that way. And I've seen a lot of benefit from that as well. Tex McQuilkin also does some stuff like that as well, I think, where it's something very high force, demanding, grinding, to use your term, followed by some actual movement to get it to carry over into things that we're after that way. And going back to your point earlier about the brain component, it's like we are literally isolating specific tissue, getting it to fire and contract without moving, and then carrying it over right into movement, and that can be same session or supersetted together and so on that way. It doesn't have to be this like 12-month progression of only doing one thing at a time. Like sometimes those progressions are literally all within the same session themselves that way. And even on the ballistic side that you mentioned as well, just with the drops, the switches, the catches, and all the different things you can do there, I love those from a training stimulus, but I also love them from an assessment standpoint. This is one of the things that I just talked about with Danny Lum recently is I'll use some of these different ballistic catch type things where you have to rapidly perform a movement and then hold a position isometrically just from a like quick and dirty like assessment standpoint, if you will. And I'll kind of add in other variables to that, right? So maybe I take the snap down, which is commonly demonized, and I get it. It's not the end all be all, but I do think there's stuff that you can take away from it from an assessment standpoint, right? Watch how they do it on the left side versus the right side. Note some different things that occur at hip, knee, ankle, and even up above at the trunk and torso, but then add other components to it. What does it look like when there's a weight in their hands and they're doing the snap down? What does it look like when they're actually rotating up top, right? If they're rotating to the left or rotating to the right, does that change what you see down below? Are they still able to control it the same way, or is it like very scattered, for lack of a better way to put it, right? Like there's an athlete I was doing this with just the other day, and I noticed when she was doing the pattern that would cause femoral external rotation, when she was doing a snap down and we were getting femoral external rotation, which would be relative tibial internal rotation, she was having a really difficult time getting to that isometric state quickly, right? Like she couldn't get to that position. She couldn't hold it. Things were shaky and unstable. And for me, it's like when I see that, I can't necessarily put a number to it, but I know just from the coach's eye component that we need to spend more time on that piece, knowing the biomechanics of the injury, knowing what can happen if we don't have good stability there, and just doing a quick and dirty eye test, left versus right side. Sometimes you can use these things to really make a lot of decisions from your programming just by what you see with your own two eyes. Building off of that even more with the drops, the catches, the oscillations, like there's a lot of things that need to be checked before you go about programming them into your your work that way with your athletes. And there needs to be some kind of framework that way for where they fit in, again, with the grand scheme of things as well. Is there anything that you've liked from your overall framework from a volume and even like the loaded standpoint to drop, switches, catches, all these different ballistic type demands that way, right? Like you mentioned the safety squat bar. When do you reach for the safety squat bar? How much load do you put on the safety squat bar for the athletes to do some of these different things that we've discussed?
Yeah, so I'd say they're pretty, synonymous. I think in some ways with like just plyometrics in nature, and just in the sense that they're high output, low duration work, and so I think with that, just inherently less is more, quality over quantity, right? We're trying to train the nervous system. We're not trying to train necessarily the structures, right? And so I just think for me, it's all about quality. In terms of like prescription and things like that, it can be anywhere, I think, from like about a half a second, in some situations, to about 2, at least in the yielding and overcoming standpoint. And then from the oscillatory things, I'll generally keep it. I probably won't go much over 6 seconds. Sometimes I'll go over a little bit, but not a whole lot. And it's generally it's no more than 3 to 4 sets, right? Again, we're after quality, not quantity. So keeping those things low. And then yeah, so I'd say dependent upon the movement, dependent upon what we're doing. Again, I think less is more. We're after the rate qualities there. We should have already fulfilled the force aspects. What I would say is like one of the things I really like doing is, again, stolen from Alex, but just the idea of utilizing different march variations and switching variations to increase not just the load, but the rate of load, right? So the first one being, we'll use an easy example of like a ankle specific athlete has a safety squat bar on their shoulders, and we're doing an ankle specific where they're in plantar flexion, and we're going to be doing some sort of marching or switching, right? And so the first one being where they have 2 feet on the ground, right? So let's just say arbitrary number, they have 400 pounds of force going between each leg, 200 pounds of force going between each leg, right? They'll lift that up slowly, meaning that one leg is going to be supporting now 400 pounds. We are going to return that leg back down and then switch, right? Then the next progression being rapidly switching those things where the leg comes back down, but we're ripping that leg off the ground now, right? So it's even more intense. So it's still 400 pounds of force going into that leg, but it's going at a much faster rate as opposed to more of like a standard traditional slower march, right? The next one being where we're actually doing a switch where you're starting with 400 pounds of force on one leg, and then there's a period of air time where the limbs are switching in air, no different than sprinting, and the leg is, coming into stance phase or sticking into the ground and rapidly spiking that 400 pounds of force into that leg. Now, right, and inherently, if we're actually looking at ground reaction force, it's much higher, right? But just the arbitrary number in terms of weight on the bar. So what I would say is we'll generally start a little bit heavier with both limbs on the ground, a slow, gradual march where both feet come to the ground. Then we'll transition to a little bit lighter, and it's a little bit of a faster switch where both feet still come in contact to the ground, but as soon as that one leg is back on the ground, the other limb is coming back up. And then finally progressing to rapid switches where there's a certain amount of airtime at a lighter weight, but a very high spike in ground reaction force.
Man, I like the way you've outlined that. And thus far, I've really enjoyed learning about your frameworks that way. What was the process to develop these things? Obviously, a little bit of trial and error and a lot of deep learning that way. You mentioned Natera, you mentioned Keith Barr, different ones that way. What have been kind of your go-to sources to put together robust frameworks for isometrics that way?
Yeah, so it's been interesting, man, and it's one of those things. It's a lot of different influences, right? I can think about it of like, I'm working on a project right now where I'm looking at isometrics on a more of a granular scale and very in depth and all these things, and it's been a lot of different people, man. Isometrics have been utilized. I mean, it's funny, like we won't get into too much, but thousands of years going all the way back to like yoga and India and Spartans and some of the long duration isometric stuff they were doing and some even overcoming stuff, which is really cool to look into. But then there's, people like Hedinger's work where like, I believe he was a German scientist back in the, and I may be misquoting that, but long time ago, and I think the 30s or 40s, where he spent about a decade doing just about every isometric, testing protocol there is that has influenced a lot of stuff where we're at today. And then from there, man, it's just kind of been this culmination of all these different people, man, right? Like I think that's one thing I've always been, I will say good at, but I've always been very fascinated in learning and, learning from all these different people. Cal Dietz, Alex Natera, Danny Loam that you talked about a little bit. Oren Chuck has done a lot of really cool things out there that maybe doesn't get the praise that he probably deserves. Jill Young has done some cool stuff. Keith Barr has done some cool stuff. So all that to say is, it's a culmination of all these different things coming together, right? So I've collected this huge framework of knowledge about isometrics. And then from there, man, I think it's just kind of been trial and error of how do I create a filter to that framework to actually apply it to my athletes, right? I think that was a mistake I made early on in my career, and this goes beyond isometrics. It's just like, I worked for like a dozen different people. I moved like 10 times in 8 years, and I had this huge experience where I got to learn under all these different people. And what I realized is that everything works, which is cool, but it's also shitty because everything works. Then it's like, well, what do I do? Right. And so what's kind of happened in the last couple of years is that what I've realized is that it all comes back to systems, and nothing really matters if you can't apply it within the context of what you do. So I guess just saying, taking all those influences and then being able to systematize it into kind of what I do now and create a structure and a framework for how I go about implementing these things has been it's kind of just a slow burn, man. Every single day is trial and error, right? Like, I'm sure there's a lot of people out there listening to this that, just in training or rehab in general, they feel overwhelmed by the amount of information out there. And what I would encourage you to do is just being able to put pen to paper on what it is that you do and how you utilize these things and your systems and your strategies and each one of these components, and then how these components all relate within the system. I think is just so important. And that goes for isometrics, but I think that goes for, everything as a practitioner and how all those things kind of operate together.
Absolutely. I could not agree more. And that's why I wanted to get a little bit of an insight as to how you developed these frameworks, because I think it's an essential thing for any coach or clinician out there, almost like a rite of passage, to try and sift through all the data, all the information that they have coming in from all the different sources that they have, and question it a little bit, right? Why am I doing this? Why am I doing that? What would be better than this? Or what could be worse than this? Like, really sitting down, being honest with yourself, and just asking yourself a ton of questions. I mean, that's part of how I ended up into this isometric side of things. And I think a lot of the times, at least I felt this way after exercise science degree wrapped up that way going into grad school. It was like, I was doing things because that's what I was taught. It was like, well, do this because, do X because of Y, or do X because so-and-so does it. And it's like, I think you really need to question and dig deeper and really have this kind of like discovery journey, if you will, as far as why you do the things you do, why you make the decisions that you make. And you can just ask yourself those questions about anything and everything, from the supersets you do to the volume you do of exercises to why you pick those exercises and beyond that way. And at least for me, from an isometric standpoint, out of school, I was in a traditional PT clinic. I did not last long. It was like a very short couple months stint. But when you're juggling multiple patients at a time and you have to look away, to work with other people, it's like, I want something that I know is going to be very difficult for them to mess up. Going back to what you mentioned before, very low risk, very high reward. So isometrics just made sense for me. I also needed them to be able to do it anywhere at any time, whether that's within the clinic itself or just outside of the clinic walls at home. And isometrics were solving that problem for me. And I had a lot of people, not just athletes, but some people that, I call them kind of more of like a lifelong athlete, if you will, that way. Maybe they're 60 or 70 and they're just playing pickleball. And it's like, that's great, but I need something that I can actually give them that will help them, that they can do, that also bridges the gap towards where they want to be. And isometrics were solving a lot of problems for me. And to your point, there's other things that could have solved those problems, right? They could have gotten better with any one of 1,000 other different things. But at least based on my experience at the time, it was like isometrics were just solving the problem so quickly. There was such a low barrier to entry, and they fit what I needed at the time, that I found ways to kind of evolve how I use them throughout the rehab process. And even now into some of these like late stage return to sport type of scenarios, and some of the things we've talked about, like, just think about some of these things I see PTs and coaches doing on Instagram where, to kind of progress their athletes back to contact, like they'll literally be like pushing their athletes around, or they'll be like smacking them with a stability ball or something like that. And at least for me, like, I just don't feel comfortable doing that in the clinic. It's not that I can't do it. It's just that I don't really want that to be their experience. So I'd rather use overcoming ISOs to create force vectors, right? How can I use one leg pushing to create this sensation of the other leg feeling like it needs to move or that it wants to rotate, and they have to learn to resist those multiplane forces. I'll also do that a lot with HEMAs, right? How can I set you up in this yielding isometric position, and I can give you a weight that maybe we're going to move it in a certain direction, and it's going to create this sensation of, oh, this wants to move or this wants to twist, and you have to work against it. You have to work to control it, almost using that isometric position as a way to teach the body how to withstand external forces that are going to make it want to move into a certain position or pattern that way, if you will. But again, it's a process to get there, and it's one that comes from a lot of continued learning, and it comes from a lot of trial and error. It's not as simple as take these things today and throw them into your programs tomorrow and your athletes are gonna all PR the next day. I wish it was that simple, but that's just not the reality of the world we live in.
No, it'd make our lives a lot easier if it was.
Dude, for sure, for sure. I realized too, we could probably talk about ISOs all day long because we're really just scratching the surface today. And I mean, that's why we do multiple podcasts about stuff, right? It's like there's just so much that goes into it, and your framework might be different from someone else's, and so on that way. There's more than one way to skin a cat at the end of the day. But I really appreciate your insights and your perspectives, and just the success that you've experienced with isometrics that way is really awesome to see. Do you have any kind of closing thoughts, closing remarks, or anything we might have missed as we were chatting today, Connor?
No, man, I think we covered all the bases there, man. I think just really just, I think for a lot of these things, it can seem overwhelming, but again, it just goes back to the things we talked about. Like once you can create a framework and identify what it is that you're trying to target, it pretty much becomes just pick and play, right? Like, this is the issue. Cool. This is the tool that we utilize to do it. Right. And I think that's, again, it goes back to just the idea of, there's so many different things that it can do, which is great. But that's why we need to systematize these things and create structures and frameworks that work within your context, right? There's going to be people listening to hear, some of the things that I do that are like, that just doesn't work in my context. Awesome. Take what you can apply, absorb, modify, apply, right? What works for you in your scenario with your athletes and what you're trying to work on. And then how can you create your system for isometrics within that works for you?
Absolutely, absolutely, Connor. For people who want to find out more about you online and maybe even work with you in person that way, where can they find you at?
Yeah. So business is located, like I said, Pittsburgh, Pennsylvania, Northeast Pittsburgh. Online, very active on social media, Instagram. There's a business account and a personal business account. Just type in at Rebuild Performance Rehab, and I'll pop up on Instagram, Twitter, YouTube, all that good stuff there. And feel free to reach out anytime.
Awesome. We'll link to all of that in the description below. That way, if you didn't quite catch it, you can just click there and see everything that Connor is up to. Dude, this was awesome. I really appreciate your time and all the insights you shared with us today.
Awesome. Thanks, man. It was great to finally get to sit down and do this.